Hi everyone, I'm Hafiz Nadiri and I'm a cardiologist training in London. In this video, I'm going to tell you about a heart condition called aortic stenosis. In your heart, you have 4 valves which work in harmony as a one-way door, allowing healthy flow of blood from one chamber of the heart to the next. They become diseased either when they don't open properly or when they don't close properly and become leaky. The aortic valve is the valve between the left ventricle of the heart, which pumps blood around the body, and the aorta, which is the largest blood vessel in the body. Aortic stenosis is when the opening of the aortic valve becomes narrowed. And it's important to quantify the degree of narrowing. We can do this by doing a heart scan called an echocardiogram, which is an ultrasound of the heart. On an echocardiogram, we see the aortic valve and the number of cusps of the aortic valve. Normally, there should be 3 cusps. We can also do specific measurements of the valve to determine the cause of the aortic stenosis. The commonest cause of aortic stenosis is calcification, which is more common the older we get. Other causes may be a congenital cause, where you're born with an abnormal valve, typically fewer cusps, a bicuspid valve, where you're born with a 2-cusp aortic valve, or a unicuspid valve, where you're born with a 1-cusp aortic valve. It can also be caused by previous radiotherapy to the chest area, infection, and now a less common cause, particularly in developed countries, is rheumatic heart disease. The stenosis can be from mild to severe. The more severe, the more worrying. Symptoms can develop at any stage during the process, but most people have no symptoms. When the aortic valve is narrow, not enough blood is pumped out of the body. This can cause the symptoms of aortic stenosis like dizziness, tiredness, breathlessness, palpitations, or even chest pain. Aortic stenosis isn't just a disease of the heart valve, it's also a disease of the heart muscle. As the heart is working harder to push the blood through a narrowed valve, it causes thickening of the heart muscle, and over time it can cause the heart to become weak, leading to heart failure. Aortic stenosis is a progressive disease, which means it gets worse over time. The disease can be life-threatening and can progress rapidly, which is why it's important to detect it early. There are treatments available for aortic stenosis. Treatment depends on the degree of the aortic stenosis and if you have symptoms. If you have mild to moderate aortic stenosis, you will usually be monitored in a valve clinic setting, and medications can be prescribed to manage symptoms. If the narrowing of the valve is severe and you develop symptoms, you can have a surgical valve replacement with open heart surgery. For patients who are not the ideal candidate to undergo surgery, we can offer a less invasive approach called a transcatheter valve implantation, or TAVI. After the valve procedure, be it surgical valve replacement or TAVI, we would do follow-up scanning and surveillance to ensure the replacement valve is working well. A specialized heart valve team with access to imaging has been shown to have favorable outcomes. This is especially true in cases where the narrowing is severe but you do not have symptoms, so there may be further tests needed to determine if intervention is required or a period of close watchful waiting. So in summary, aortic stenosis is a disease of the aortic valve where the opening of the valve becomes narrowed. Treatment depends on the severity of the narrowing and presence of any symptoms. If you have found this video helpful, be sure to hit the subscribe button, the bell icon, so you're up to date with my videos. Thank you for watching, and I'll see you in the next video.